The CDU element of the service consists of nurse practitioners, so that we have a team of nurse practitioners who cover the unit Monday to Friday, and they cover from the morning till 8 o'clock at night, and that's how the service run. And that come from the figures that we were looking at, and that told when our patient demographics, when the patients were coming in and when they were accessing the service. At the time on surgery, we didn't have nurse practitioners working. We just had sort of like the first person the patient saw was one of the doctors or one of the registrars, and then the consultant. So that was one of the first challenges that we had, to try and implement and introduce a new concept of a nurse practitioner working in with the surgical areas. We went out to advert to develop some nurse practitioners, and we were quite fortunate that we actually had some very good skills within our own nursing team to be able to develop that forward. And I think that was key. I think we've nurtured these nurses through from the beginning, put them through the clinical skills course. They've gone on to do non-medical prescribing programme, and you can see the skills development sort of like as the service grows and the confidence grows in their own abilities.
It's an assessment unit, a triage, see and treat, for patients that are coming in from community through the GP surgery that possibly would require surgical review and query admission onto the ward. If not, a full assessment with a senior surgical registrar, consultant, tests and assessment whether they need to be admitted to hospital for potential surgery or not. Prevention of unnecessary admissions onto the hospital floor, quick turnover of diagnostics results, instant access to the surgical review for the GP, something that possibly might have taken a little bit longer before this unit was set up, availability of scans for patients that GPs would take a good couple of weeks to get hold of if they were going through them. We'd saved 3,000 bed days from the last audit that we'd done over a space of a couple of months. When you audit the whole amount of inpatient stay, it's gone down from something like 4.2 I think to 3.2 average days of stay, which is quite phenomenal realistically compared to other hospitals and statistics.
Try to bring on board some of the ENT services. We need to sort of try to move to a much more 24/7 model, so that we can, because that's when the ENT admissions, when we need the support from the ENT patients. So that's what we're working towards at the moment. You know, there's still some gaps there in the system, but that's what ultimately aim that we provide this care 24/7.